Hello, good morning, good Sunday morning, Princeton Integrative Health Community. Nice to see everyone. Sorry I'm on a few minutes late, having trouble accessing my camera on my laptop, so I had to switch over to my phone. It caught me off guard, but I'll have to, couldn't figure it out myself. I'll probably need some tech support from somebody on that. So wanted to go over a few things today. First thing I want to mention is checking out our website for the Mercer Masks fundraiser. Good morning, Nancy. Mercer Masks fundraiser. Mercer Masks is a local group that has 100 volunteers or more now making homemade masks for healthcare workers due to the shortage of supplies. They're also starting to make personal gowns. They can use donations of fabric, donations of sheets to make the gowns, and they're also going to try to make surgical caps. So, worthy cause. Everything is local. Started out with one nurse wanting to get herself a mask from a friend who was a seamstress, and has spread into, they've made 7,000 masks now, probably more than that now, and they have 100 volunteers sewing, so let's support them. You can find the information on our website, and there's a Facebook page for Mercer Masks, and I believe their website is mercermasks.com, but the information is on our website. I'll mention this again at the end. So since we're on the mask, talking about masks, came across an article just this morning on National Public Radio, that if you wear nylon, so if you cut the leg of a pantyhose, they said queen size is best for breathability and comfort, but if you put that over your homemade mask, that seals the edges of the mask so that the virus particles can't come in over the edge and have to come through the mask. That reduces the amount of virus particles spreading by about 80%. It becomes equivalent to a hospital surgical mask, essentially. So, not the N95s, but, the regular surgical masks you see at the hospital reduce about 80% also. So, interesting study. If you're going to be going into a high-risk environment, I would recommend that you do that to decrease transmission. And don't forget all our other, on our immune support group, taking a look at that and rinsing your nose with hypertonic saline, as I've talked about before, to help decrease the virus particles and to generate hypochlorite acid in your nasal mucosa, which is our body's bleach, essentially. So we know that bleach kills the virus. So a couple of tips there for you. Topic this morning is the main topic is about whether the coronavirus is going to slow over the summer. Is it going to be seasonal, like the seasonal flu, colds, that kind of thing? What? So the first question is, why does the seasonal flu slow during the summer? It has to do with the relative humidity. So when the relative humidity is higher, the flu doesn't spread as easily. And why is that? So during the winter, when the conditions are dry, the flu, when it comes out in droplets, the dry air sucks the water vapor out of the droplets, and then the virus becomes airborne. So it's easier to spread that way. So same thing happens with coronavirus, that with comes out in droplets, but it can be, under certain conditions, aerosolized. Seems to be transmission both ways. We're not sure the aerosol component, the airborne component, how important it is yet. Certainly if you're a medical worker and you're aerosolizing a large amount right, into your face, then that becomes important. We're not sure about the community yet. So, again, droplets, it's becoming aerosolized, relative humidity. The way I remember the relative humidity part of it, whether it'll keep something in a droplet, is that I had a friend, I have a friend, Dr. Mark, up in Ithaca, New York, who would go to a music festival every year, and he would make bubbles. He would make his own homemade bubbles, and these bubbles would be 2-3 feet across when they would blow them, or use the wands to make them. He had bubble generators and everything. People loved it. So, but sometimes he could get the bubbles to, they would float 30, 60 seconds, sometimes even farther, until they were out of sight sometimes. Other times they wouldn't last more than, just a few seconds. And why was that? Relative humidity again. When low relative humidity sucks the water vapor out, and boom, the bubble would burst. Same thing with these respiratory viruses. In low relative humidity, they come out in the droplet. The dry air sucks the water vapor out, and then you have an aerosolized virus. So we have to remember that mode of transmission as we go along. It becomes aerosolized, then people who are farther away than 6 feet can actually be exposed. Again, the farther away you are, the better. Masks are important. Using the nylon over the mask becomes even more important in that case. The World Health Organization and Centers for Disease Control feel most of the transmission is droplet, and that seems to be the way it's going right now. But there are some indications from China that there was some aerosol transmission, people farther away than an index case in a restaurant, not the, certainly the people at the next table over were the most infected, but people even farther away were infected, not as high a rate. So there could be some aerosol transmission, especially if people are not wearing masks and that kind of thing. So if the virus acts like other coronaviruses, other flus, there is going to be some seasonality due to airborne transmission. As we've seen with the flu, that airborne transmission is what makes it more prevalent during the winter because of that dry air, relative humidity low, sucks the water vapor out, gets aerosolized, spreads more easily. I guess my question is going to be, if we're all wearing masks, is it going to cut down on the amount of flu that's spread during these seasons? So that'll be another interesting thing to watch out for. So if it's more of the airborne transmission, there'll be seasonality. If it's mostly droplet transmission, there won't be much seasonality. It'll continue through the summer. We'll have to continue with precautions and that kind of thing. We've seen that even in the hotter states in the U.S., Florida and Louisiana, those states have gotten hit pretty hard, So, and H1N1, back in 2009, it actually started in May and June and spread through the country during the summer. So, it became seasonal, but after a couple of years, when people were not immune, it just continued to spread throughout the population. As immunity developed, became much more of a seasonal type of illness, like the other flus. So, you know, is this cause for concern if it's airborne? Yeah, some. But what we've also seen is that the larger the dose, the more likely that you're going to get a larger dose. I'm not sure exactly how I said that. So if it's in droplet, you'll get a larger dose than you will if it's aerosolized and you're 10 feet away. The larger the dose, the more likely you are to get sick. Healthcare workers are the extreme example of this. Young, healthy people, no risk factors, large doses, being exposed in healthcare settings, those people are getting sick. We're not seen as, so the healthcare workers, those are the, obviously the frontline people, the higher dose people. So that's why it's important to protect them as much as we can, get them their personal protective equipment and everything. Because they are literally on the front lines and getting the highest doses, much more than we are getting walking around in the community. So if it's airborne, you're going to get a lower dose. Lower dose seems to be equating for some people, everything else being equal, with less severe illness. So that could be why some people are either asymptomatic or have mild symptoms. That could be part of it, other than their own, innate immunity. That if they get a lower dose, they might get infected, but not the severe infection. Again, multiple factors. A lot depends on your own ability to cope with this virus. And we've talked about that. Jenna's Immune Support Group has a lot of tips and that kind of thing for that. But we want to keep the dose as low as possible. So the masks, the nylons over the mask can help reduce that even more. And so, it's going to be interesting to see as summer comes what's going to happen. And, what's going to happen in the southern hemisphere, because it seems like it's spreading a little bit slower there. And are they going to be, because they're already in their, I guess, probably, so their fall heading into winter now. We'll have to see what happens as they actually head into winter, their winter, as we head into summer, and see if their numbers tend to go up. So, good morning, Caitlin. Good morning, Dorothy. Good morning, Dana. Nice to see all of you. Thank you so much for joining me this morning. Are there any questions? Is that my screen, Dorothy, that's frozen, that I'm going out and coming back in? So, let's see, Nancy has a question, hang on. Let's see, Nancy, there was no vaccine in the Spanish flu, SARS, etc., and eventually stopped. Seems that there may not be a COVID vaccine. Is there any prediction of how long it will remain based on previous pandemics? I think a lot of people are thinking that probably that, 18 months to 2 years before we get sufficient herd immunity, so to speak. I think would be what I would think. I think the Spanish flu was going on 1918 to 1919. So, 12 months, 18 months, up to 24 months, I would think would be the my interpretation of all that. And as I said, the H1N1 flu, it took about 2 years for it to become more of a seasonal thing versus, having kind of a year-round spread. So that's our best guess. We, that being said, I would say that because there will be, as this moves through, there will be more and more people who are immune in the community. So we shouldn't see the numbers that we're seeing now. So, thank you, Dana. Glad the transmission's going okay. After my technical problems this morning where I couldn't get my camera up on my laptop. Fortunately, with the phone, we're able to switch right over. So I feel blessed by all this technology. Welcome back, Dorothy. So let me, for people who aren't on right when I started, let me just mention the Mercer Masks Project. You can check it out on our website. But again, these are local folks who are making homemade masks for healthcare workers since supplies are in such short demand. They started out to make one mask for one nurse and decided that they would, expand that. And now they have 100 people sewing masks, 100 or more, and they've made 7,000 masks. So, you can find information on our website or Google them. They have a Facebook page, Mercer Masks, and I think their website is mercermask.com, but the information is on our website. They're looking for donations of fabric, of sheets to make actually gowns. They're also going to make surgical caps, and they have a GoFundMe page. So worthy local effort, and everything is going to benefit people in our local community, our healthcare workers who are, at the most risk. And check out my nylon study, cutting leg off pantyhose and putting it over your homemade mask actually makes it. Studies are showing that it's about the equivalent of a regular medical grade surgical mask, not the N95 masks, but a regular surgical mask. So check that out also on the website. Dorothy has a question. World Health Organization is saying immunity is not guaranteed, not apparent. Yes, actually, I think I did one. I'm not sure if that was my last Facebook Live. They just don't know. We don't know because those people have not been rechallenged yet with the virus coming back through. So it's hard to tell. If it acts like other flus, coronaviruses, there will be immunity. At least to that strain. We'll have to see how much this strain mutates and that kind of thing. And I guess the other reason I say that there's probably immunity is that people with the Spanish flu, this goes back to the Spanish flu, they took the plasma of people who were infected and gave it to people who were not infected, and those people did better. There's some indications that the plasma of people infected with COVID-19 are doing better, somewhat, than not. So I think that there is going to be some immunity, and we'll see. We're not sure yet. Let's see, Nancy asked a question. Well, let me finish up with Dorothy's here. She has another question. Flu doesn't have immunity, does it? Flu does have immunity. If you get the flu during one season, you're immune to that particular strain. The flu vaccine, they're trying to guess what strain. If they hit the strain right on, people generate immunity to the flu virus. Problem is, we're never sure which flu strain is coming. So you have to, it's a guess. That's why some years it's the flu vaccine works better than other years. So yes, it does have immunity. Problem with the flu is that it mutates, so that we're not exposed to that one. So the we are not immune. Also, immunity can wane. That's the other issue. We don't know how long. If there is immunity to COVID-19, as I suspect there is, we don't know how long that's going to last. Is it going to last, 6 months, a year, 2 years? Nobody knows. Some viruses we are exposed to them, and the immunity lasts a lifetime. Varicella, chickenpox is one example. So Nancy's asking, what the best supplements are. Nancy, certainly an all-around good vegetable-based, phytonutrient-rich diet is your first line of defense. Things like zinc, vitamin D, things to help your gut, collagen, colostrum, ginger and turmeric have their place. Quercetin has their place. Jenna has a lot of this on her immune support site, what the best supplements are. And, maybe what I'll do is on the Wednesday Facebook Live, I'll go back and review this again and answer in more depth there. How would that be, Nancy? Essential oils can certainly be helpful. Caitlin mentioned she's using essential oil, thieves oil. Certainly the essential oils can be helpful. Some of them can be used for sanitizing and that kind of thing. Morning, Betsy. Morning, Carlene. See, Dana is saying, article I read I was doing research and it claimed there are certain blood types that are not affected. They did, however, say they're still working on this research. Do you hear anything about that? I've heard that more, some blood types are more susceptible than others. So, I'd be interested in seeing their research. If you have a link for me to look at, I'd be happy to look at it. But I don't know that they're blood typing people who come in, so I don't really know. I guess there could be differences in immunity, but I think that's overwhelmed by what's going on with people, how they're living their lifestyle and, their nutrition and that kind of thing. So, but certainly an interesting angle. All right. You're welcome, Nancy. So, all right, I'll just mention it one more time about the Mercer Masks Project. For anybody who wasn't watching, check out our website for that, Worthy Local Cause, where they're making masks, starting to make gowns and surgical caps for our local healthcare workers to protect them, because those are certainly the people who are most at risk. All right, well, it's been just about half an hour, and I will sign off, and I'm going to review supplements again on Wednesday. Thank you, Dana. Okay, everyone have a great Sunday, and I'll see you on Wednesday. Take care. Bye-bye.